Hello, and thank you for tuning in to Intermountain Healthcare's medical information session for people who are considering treatment with radioactive iodine for thyroid cancer. In this session, you can expect to receive information on the thyroid and thyroid cancer, benefits and risks of treating thyroid cancer with radioactive iodine, preparation prior to iodine-131 therapy and arriving for your treatment, and radiation safety precautions to be followed after treatment with iodine-131. While this session is meant to be informative, it may not answer all questions about your treatment. Any unanswered questions should be addressed with your treating physician. Let's get started by talking a little about how the thyroid gland functions. The thyroid is a butterfly-shaped gland that is located in the lower neck. Its primary function is to make thyroid hormone, which affects many bodily functions, including the body's metabolism, heart rate, respiratory rate, and bone strength. Thyroid cells are responsible for making a thyroid hormone. Thyroid cell membrane receptors bring needed ingredients into thyroid cells to make thyroid hormone and then release it into the blood. One of these receptors brings iodine into the thyroid cell, where it combines with a protein called thyroglobulin to make thyroid hormone. Because various diseases can affect thyroid gland function, our bodies help control the production of thyroid hormone using other hormones. TSH, or thyroid stimulating hormone, serves as the primary tool to help keep our thyroid glands producing the correct amount of hormone. I will talk briefly about TSH and its relationship to the production of thyroid hormone. In the graphics just presented, you may have noticed that in addition to thyroid cells having receptors for iodine, there are receptors for TSH as well. TSH is made by the pituitary gland, which is located near the base of the brain. TSH is aptly named because it stimulates the cells of the thyroid gland to produce thyroid hormone. The thyroid gland and the pituitary gland communicate with one another. It is the responsibility of the pituitary gland to help keep thyroid hormone blood levels stable. If your body senses that your thyroid hormone levels are starting to rise more than what is healthy, the pituitary gland stops producing TSH. On the other hand, if thyroid hormone levels start dropping, the pituitary gland starts ramping up production of TSH. As I pointed out on the earlier graphic, the thyroid cell has receptors for TSH on its membrane. When TSH occupies those receptors, this signals the cell to make more thyroid hormone. It is a type of communication with the pituitary gland that tells the thyroid gland to make more hormone. An example to help understand how the thyroid works with the pituitary gland is to think about when you are driving your car on a long road trip. You set the cruise control at 70 miles per hour. When you're traveling on flat terrain, the gas consumption is stable. When you eventually get to a mountain, all of a sudden the car starts slowing. The cruise control computer in the car senses you're going too slowly. It realizes, oh, we need more gas. So it sends more gas to the engine to keep the car at 70 miles per hour. On the other hand, if you start going down the mountain on the other side, the computer senses you are going too fast and stops sending so much gas to the engine, once again keeping you at 70 miles per hour. Similar to a vehicle's cruise control computer, the pituitary gland senses if you have too much or too little thyroid hormone in your blood. When the thyroid gland has been surgically removed, the pituitary increases the production of TSH. This is one of the principal ways that the body regulates thyroid hormone.